nobody who's lost anyone in COVID is going, well, at least I didn't lose as many people as somebody in another country, or I lost the same number of family members as someone in another country. I feel better. No, I'm sorry. We could have been better.
Right.
And that's what we need to be looking at. We did not serve our population as well as we could have. And that's what we need to look at. We can't keep going, well, other countries did just as badly. I don't care. We are not in another country. You are not the government of another country. So stop using your comparison to another country as an excuse for the number of people that died. That is completely disrespectful to everybody that suffered.
You are comedy's foremost doctor of virology, I think.
I am. There's a few of us, but I'm the foremost.
When it comes to comedians who have PhDs in virology, I'm sure you lead the pack. What's your take here on the COVID inquiry this week? Do you think, because I keep thinking the Boris Johnson, yes, it was a farce. Yes, it was ridiculous. Yes, there was this real sense of tumbling chaos that I at the time found terrifying. Yet at the end, when they turn around and say, you know what, nowhere in the world did much better than us, you're kind of like, well, yeah.
I think that this is the thing, when you look back at the performance that they gave over the course of the 3 years, and I have to say I'm finding the whole COVID inquiry a little bit triggering in terms of I don't remember the order that things happened, because we were just home all of the time. I don't remember lockdown 1, lockdown 2.
Meaning.
When were we in tier 2? When were we in tier 1? I don't remember the timeline. And now we're going through it again, and we're actually being reminded of where we were at which point. And it actually sparks a lot of anger, because I remember sitting yelling at the television. I mean, that first February in 2020, when we weren't locking down and we weren't closing borders, and I was sitting there going, how come we are interviewing a super spreader on the news and finding this funny? He was there going, I had no idea. I came from Singapore. I went skiing with my family in Europe, and then I came back, and he'd spread this unknown disease across three countries. And to watch Boris sit there and fob everything off on everybody else. We have a hierarchy. We have, when you're at the top, if you're the director of a company, if you're the chair of a board, the understanding is that legally the buck stops with you. And here we have him sitting here. And even though we have diaries and we have actual notes that say, you're the one who said, let it rip. You're the one who used that term. You were the one bandying about it. He went, well, everybody was bandying about it. It wasn't really me. Well, yeah, of course I had to talk about it. There were people in the meetings. Of course I wanted to save people, when we know it to be categorically not the way that he was handling it. We felt it at the time. We now have evidence of it at the time, and it's and now I'm being doubly triggered by just seeing him again and being reminded of the way that he was in power and what he's doing now. I don't even know, in some regards, why are we having this inquiry? Well, every single person we've interviewed from government has gone, well, it wasn't really me, it was somebody else. No, I wanted to save people. I was really caring about all the people, but it was everybody else around me that didn't. I'm not sure we're achieving anything.
But that's kind of the crucial point. I mean, Rachel, I think that's the crucial point, that this is an inquiry that is there to show us where we went wrong and how we could avoid going wrong in the future, to learn lessons. It's not a trial. These people are not on trial for their failings. It's not like after you've won a war, you put the losers on trial. Sometimes it feels a little bit like that. I was speaking last week to Dr. Phil Hammond about the COVID inquiry. He made the point again and again that maybe we're just not learning lessons here. Maybe we're doing the wrong thing, that we're looking for the people to be cross with, perhaps rightly, but we're not doing the kind of here are the bullet points of the things we do differently next time.
Yeah, and I think that's a real danger. I have been to the COVID inquiry at least three times, like lockdowns, they all just blur. But I've sort of sat there and watched Matt Hancock's evidence, Boris Johnson's evidence. And I think there is a real issue that the inquiry is trying to do two very separate things, one of which is what its stated aim is, which is to make sure that we're better prepared for the next pandemic or the next disaster on this scale. What can we learn from it? What needs to change? What mechanisms of governing do we need to put in place? Who needs to be in the rooms when those decisions are made? What did we miss, and how did those mistakes happen, and how can we make sure they don't do it again? I think the issue is that people, the public, want politicians to be held to account, because everyone went through a vast amount of suffering. People lost loved ones. People also lost their livelihoods or missed key life events. I think if you try to add up just the amount of suffering that we all as a nation went through during those 3 years, both because of COVID and because of the sort of chaotic response to it, that there was a huge amount of suffering there. And we kind of have this naive belief, maybe, that if something goes wrong in your life and it's somebody else's fault, you should hold them accountable for that. I've seen people on Twitter saying that they think it's really unfair that people like Matt Hancock and Boris Johnson are not going to face criminal sanctions for what they got wrong in this. And I think it's this idea of something hurt me and I want there to be consequences for it. And they're trying to use the COVID inquiry to have those consequences play out.
What we've learned is that there is no law against incompetence. That's the problem, is that they were incompetent in a number of ways. And I feel like we already know what we needed to know at the beginning. I feel like we were supposed to listen to the people that understood what was going on, the epidemiologists, the public health officials, and then we had a bunch of people with no medical training actually in charge of the decision making. But the question is, if the whole point of the inquiry is to go, well, what can we learn? How can we do this differently? Who's we? The people in charge who were supposed to be taking notes and learning lessons are the people who have followed on from Boris. It's Rishi at the moment. But who's learning the lesson? Who's changing what's happening next time?
But you might learn that, perhaps the lesson is that we have to tread more carefully when we think about who we put in government. Because
this whole inquiry is for the is to blame the public for who they voted in. Ultimately.
But again, if you're looking at blame is another matter. I think when you look back to the period that a lot of this is about, early COVID, a lot of the trauma. Look, I was lucky enough. I didn't lose anyone because of COVID, partly because my mother was, lucky enough to leave us shortly beforehand. She was very ill, but it was a traumatic time. We got very sick. But a lot of the anxiety that I and a lot of people I know suffered was entirely because of this idea that the wheels are off. No one's in charge. The system of government in this country seems to be collapsing. We're not sure how much longer there's going to be food, law and order, petrol, all this stuff just sort of ground to a halt. And so I think it is very important to look at just general competence of government at a time like that. All that being said, maybe we just should be learning sort of medical lessons, scientific lessons, don't you think?
I think we can learn lessons about how decisions are made, and there have been days when there's been evidence that's come out that has made me go, okay, that is actually something that we need to think about.
Right.
So Helen McNamara, one of the chief civil servants, pointed out that in a lot of the rooms where the decisions were being made about lockdown, there weren't enough women, there wasn't enough diversity in general. So issues of, hang on, like if you close all the schools, who's going to parent the children and everyone's working from home? Or what are you going to do about victims of domestic violence? Or what are you going to do about women who are pregnant or giving birth and have to do so alone and while their partners are in hospital car parks? Like things like that, where if you'd had people in the room who had a wider set of experiences, you could have come up with policies that were more humane, or that just understood, for example, that people live differently. I think a lot of the issues with the lockdown rules and the way they were policed was they were written by people who had big houses and big gardens and very good internet connections, and they didn't think about what it was like if you were a family with lots of children in a one-room council flat, for example. And I think that is an important lesson to learn, which is if you're going through some kind of national emergency, have a diverse group of people in the room who can think through the consequences of the decisions you're making. That's not about apportioning blame. Well, it was the Prime Minister's job to do this, the Health Secretary should have done that. It's about the structures of government.
Ria.
Well, first of all, we have to bear in mind that a lot of that happened because we have a government, as especially a prime minister, who refused to protect women. It came up, shall we protect women in law against, in terms of crime? And he went, nah, we don't. So what you're saying is that we need to have a more diverse government, but we already know that the elitism of the group that was in charge has caused so many more problems than just those acute issues that you're talking about during the pandemic. We're seeing that across the board with the NHS being dismantled because they want everyone to move to private healthcare. So how to learn that lesson, we've known that. We knew those things before going into the pandemic, that the elitism of this government is causing people with a range of backgrounds to suffer. But who I ask again, who's learning the lesson and who's making these changes?
Well, again, maybe that's why it should be more, sort of science and COVID specific. So Mark from Sussex has been in touch while we're talking. He says, Hugo, remind me which major country didn't suffer similar levels of impact from COVID regarding deaths and illness. It's like, well, Mark, it's pretty clear, the picture that we were...
New Zealand.
We were well, there are the places that did outstandingly well, such as New Zealand and bits of Scandinavia, but we were worse than France and Germany Italy and better than Italy. And the whole question is whether, as Britain, we
no.
should have been much better than everybody.
I'm sorry, but this whole comparing yourself to other countries, nobody who's lost anyone in COVID is going, well, at least I didn't lose as many people as somebody in another country, or I lost the same number of family members as someone in another country. I feel better. No, I'm sorry. We could have been better.
Right.
And that's what we need to be looking at. We did not serve our population as well as we could have. And that's what we need to look at. We can't keep going, well, other countries did just as badly. I don't care. We are not in another country. You are not the government of another country. So stop using your comparison to another country as an excuse for the number of people that died. That is completely disrespectful to everybody that suffered through that time.
Well, I think that's powerfully and well said.